Homeopathic medicine number 1, Abies canadensis. Abies canadensis, the medicine is prepared from bark of a tree known as hemlock spruce. So the mother tincture of the medicine is prepared from bark of a large tree named as hemlock spruce. This medicine is not proved thoroughly. However, the fragmentary proving gives the symptoms only one or two, and on the basis of that symptom or those symptoms, we can prescribe the medicine. Now, what are the fragmentary proving symptoms? The fragmentary proving symptoms are number 1, dyspepsia. This medicine acts over dyspepsia. Dyspepsia, that means indigestion, disturbed digestion. Now, for disturbed digestion, there are so many medicines in homeopathy. The chronic dyspepsia cannot be cured by acute medicines. For permanent cure of the chronic dyspepsia, it is essential to prescribe a deep-acting anti-miasmatic or constitutional medicine. But for acute stage, acute relieving drugs are necessary. Such drugs are ipecac. Symptoms are thirstlessness, constant nausea, profuse salivation, clean tongue, etc. For carbobase, when the dyspepsia is originated from taking the spoiled fish, meat or foods, upper part of the abdomen is more flatulent than the lower. Extremities and palm soles are cold. The patient is hot, always prefers open air. Belching or eructation gives temporary relief. These are the main guiding symptoms for selection of carbo vegetables. We may prescribe pulsatilla too. When the dyspepsia is originated from taking pastry, cake, or fatty foods, fatty meats, etc., tongue dry, thirstlessness, no two stools, no 2 times vomiting are alike, because changeability is one of the guiding symptoms of pulsatilla. We may prescribe China officinalis when the full abdomen is flatulent. There are eructations or belchings, but that does not give any relief. Patient is weak, prostrated, may suffer from loose stool, etc. Now, what are the guiding symptoms of Abies canadensis? The dyspepsia is always with ravenous hunger. Appetite is too much increased. So, dyspepsia, when associated with too much hunger or ravenous appetite, please think of Abies canadensis. And the patient has a tendency to overeating. More the appetite increased, more there is demanding of intake of foods. The patient takes a lot of food. Then what happens? You know, the upper part of the stomach, the bulging portion is known as fundus of the stomach. So when the food, generally the food does not go to the fundus. It lies at the level of the cardiac end, junction of the esophagus. But when the patient eats more, the food may accumulate, gives pressure to the fundus side, and then the fundus give thrust to the diaphragm. Diaphragm means the partition between thorax and abdomen. And just above the diaphragm, there is heart, the base of the heart. And if the stomach gives thrust, pressure, upward pressure to the diaphragm, the partition, it gives pressure also to the base of the heart, apex of the heart. In all the structures, base generally at the below, except heart. The heart's base means posterior surface. So when the pressure gives to the apex of the heart, there is palpitation of the heart. So ravenous appetite, dyspepsia with ravenous appetite and with palpitation of the heart, number 1. Number 2, as a result of dyspepsia, there is lack of assimilation, disturbed digestion, so patient becomes weak and prostrated. So there is always weak, all the time the patient is weak, prostrated and tired. He wants to lie down. Be remember, my friends, our Gelsemium patient is weak, also always wants to lie down, but that is due to nervous weakness. And the weakness of the Abies canadensis is due to dyspepsia, disturbed digestion. So this is the main symptom, dyspepsia with increased appetite, with palpitation of the chest, of the heart, and with weakness or prostration. The patient wants to lie down all the time. I have compared a few acute medicines for dyspepsia in comparison with these Abies canadensis. And for increased appetite, you must know some of the important medicines from our Mathematica, Sina, China, graphitis, iodine, lycopodium, petroleum, natramium, phosphorus, sorinum, etc. Sorinum, phosphorus, iodine, lycopodium, Sina, China, these medicines having increased appetite. So these proving symptoms are also verified clinically. Increased appetite with palpitation and with weakness, profound weakness, are the 3 guiding symptoms of Abies canadensis. You may prescribe in acute stages, and after overcome that, you please go through the original constitutional medicine or deep-acting anti-miasmatic medicine. Now, what potency you will prescribe? You may prescribe 6 few doses or 30 few doses. Generally, I prescribe 6 or 30 few doses. And by Abies canadensis, I have found greater results in many dyspeptic patients. So, you may try by Abies canadensis in the dyspeptic patients, especially in acute distress. Thank you very much.